Hello, everybody, and welcome to another podcast of the Sensory Approach to Manual Therapy. My guest today is Michael Hamm, who is a presenter who I became familiar with back in 2015 and finally had the opportunity to meet in Colorado in 2017 when we brought him out there to do a presentation on research. It was a presentation that stuck with myself and many of our members in Colorado because it was one of the only times I've ever done an 8-hour lecture class and not been bored with no hands-on material for 8 hours straight, which was a unique experience to have. So welcome, Michael.
Thank you. That's a concise and very kind intro. Thank you.
So I just want to go over a little bit about your past before we start into some of the nitty-gritty conversations. You went to massage therapy school in 2005, is that correct?
2004 or 5, yeah.
2004 or 5. And so you and I actually have very similar lives, and that's exactly when I went to school and graduated. And I was, we've spoken about this back in 2017 and a few times over Facebook since then, but we've got a very similar mentality when it comes to massage. We tend not to want to isolate to the biomechanical, to the structural. It's relevant and it's important, but it's not the end all be all. And we tend to want to dig deeper. And I know I've taken some of your classes and attended a lot of your Facebook Live presentations, particularly during COVID. And I found them of great interest. So it's been a while that I've actually wanted to have you on the podcast. So I'm really glad we could do this today. So thanks.
I'm grateful to be here, Troy. Every time we've talked, I've come away learning something, and that's my hope for today as well.
Fantastic. When you graduated, one of the things that I remember that always surprised me was you went instantly to the MTF, to the Massage Therapy Foundation, and you became a trustee immediately, correct?
Not immediately. It took can't remember how many years. It actually was over 6 years before I became a trustee, but I immediately went into volunteering with the Massage Therapy Foundation, which was an outgrowth actually of participating in their first sort of case report contest.
For which you won the gold award, correct, that year?
I was co-winner of the gold award for the first case report, student case report contest, which was this brilliant idea put forth by the Massage Therapy Foundation. Said we look and we're seeing a growing field of research evidence for massage therapy, but a lot of it is not terribly well informed by actual practice. So what we need is something at the bottom of the pyramid that is sort of like reports from practice. And what we need is a capacity in our profession to have folks capable of telling stories to the research world, to say, hey, y'all, this happened in my practice. Here's what I did, here's what the outcome was, and here's what I think about it. And that's a case report, and getting people capable of writing a research form of case report and publishing it was the point of that contest. And to me, I was just like in massage school, and my teacher mentioned the contest and said, here's this research contest, you submit a report of your sessions, blah, 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 $2,500. And
$2,500 as a new massage therapist.
let's say that created a response in my reticular activating system and a little bit of more vigilance. And the next thought, because I'm also a musician, is like, wow, I could get a sweet electric guitar for that. And I did.
That's awesome. And that paper, what was that one on? Was that the open source paper, that gold award?
That paper was a case report of sessions with a fellow student of mine, actually, who had costovertebral dysfunction, so rib head dysfunction, as well as scoliosis and thoracic outlet syndrome. So in terms of the practice, I had as specified by the contest, I had a clinical advisor and a faculty member at my school who sort of gave me some techniques, and we did a semi-prospective 8 sessions of like, here I'm going to do these techniques in these regions and see if we can help unwind this linked set of pathologies, this structural pattern, this feedback loop of nerve entrapment in the shoulder. And I didn't really know what I was doing, but the contest guidelines were specific enough, to just kind of go through that process. And at the end was a case report that, at least in the first year of the contest, was sufficient to be a co-winner. It's hard work, but it also felt like it catapulted me into a conviction that like this kind of storytelling was crucial in the profession. And that's also why I started volunteering with the case report committee and the education committee, which is how I ended up becoming a trustee 6 years later.
Awesome. So there are two things that I want to talk about in there. One, which we'll come back to, which is after you had won the award and where you kept going with your career, especially since it sounds like you might have been on the committee for one of the papers that I want to talk about today. But the first thing is, and this is a little bit of a tangent, but it's similar to a lot of the stuff that I've looked at and a lot of the stuff new therapists are coming across. We go to school, we learn certain techniques, and we learn certain sciences and research. Whether the research is correct or wrong, let's just ignore that fact. We'll start with the fact that it's what we learn. And so right there, when you were describing the case report, you described it as that, this person had rib head dysfunction and you were going through the structural approach. Now we're talking 10, 17, 18 years later. Would you still, knowing what you do now and teaching what you teach now, would you still describe what you had done, rib head dysfunction, structural stuff? Would you still describe it similarly, or would your thought process now be different from what you originally learned in your introductory education to massage?
It's a great question. I think I may have employed some similar forms of therapeutic intent, shall we say. But I might have framed very differently the reality or unreality of the pictures in my brain.
So you get to a really good, interesting crux of the matter, which is, when you say that, it's like clinically the outcome was positive, and clinically what you did with your body to the person's body might have looked similar from the outside, but mechanistically what you thought was happening was different. Am I right in thinking that's where it is?
Oh, absolutely, that happens. Anyone who's paying attention over the course of 18 years of practice, which is my current duration of massage, I hope has undergone at least a systematic demolition of the ideas that they were trained in. I know you're shaking your head, but
I shake my head because it's I just came back from national last week at our kind of AMTA convention, and no, the demolition of what we founded massage therapy on in the last 30 years, the image is still very concrete.
Well, I want to put a pin in like what causes the stalwart resistance to updating a therapeutic model, because I don't think it's just stubbornness. I think there's value in the frameworks we were taught, and unless we recognize it correctly, I think it's hard to convince ourselves, even let alone another person, to evolve how we understand what we're doing.
I think it's statistics. I think it's, if I treat 100 clients and I do what I was taught in school, and 75-85% of them get better and 15% don't, then those techniques for the majority of the humans are going to be beneficial no matter my understanding of it. It's that extra 15% where, when we start exploring why a technique on subject A worked and on subject B did not work, even though they present themselves in the same way, when we start demolishing that and go, well, it didn't work on subject B, so obviously on subject A, it was coincidence that it worked. And we start breaking it down more. That's where we start getting into people. It's funny. I've been accused by a lot of therapists as not liking massage therapy, even though I've also been in the profession 18 years. I have a full-time clinic. I teach 14, 15 times a year. I love massage therapy, but it's because I'm not a big fan of staying stuck in the past. Although the past is essential to where we're going. If the past, if we hadn't gone through the biomechanical and the structural modalities, which still have a place, I wouldn't know where to go next. I'd still be on that first stepping stone. I wouldn't be on the second stepping stone kind of thing. And
Yeah.
it's just an interesting one to think that I don't see it so much as stuck in the past as much as just statistically, I'm going to get the majority of people better doing these ones. Why would I bother learning the rest?
I think what you demonstrate is what I aspire to, which is a security enough in the value of your person, in the value of the therapeutic interaction, that you are willing to hold lightly the sort of mechanistic understanding of what's going on, and you're also willing to say a big effect that we can't usually see in practice is just the effect of normal regression back to the mean, of people tend to get better over time, but also the effect of someone whom you trust paying attention to you for an hour. And unless we recognize that whatever, technique or clinical approach choices we make is within that larger context, that we are, clearly we are holding someone in a trusting container for long enough for the natural course of their condition to evolve, as well as for the profound endogenous responses to caring hands and caring presence to do their work. And that is probably the majority of the effect. And it does not mean that one's choices don't matter, but it does mean that that's like the swamping effect, and whatever we call our sort of professional choices within that, let's say it is. I think you demonstrate a willingness to give a lot of credit to that phenomenon without perhaps devaluing what it means to be a good practitioner and to be skilled in what you do.
Yeah, I think I like how you said the swamping effect because Dr. Gulia Peoria, who's a PhD at the University of Essex, who specializes in ASMR, her and I did a podcast 2 years ago or now, and one of the concepts that we talked a lot about are the similarities between ASMR and massage therapy, but even psychotherapy, and even just therapy in general. And it doesn't have to be massage; it can be physical therapy and osteo and all these things. And one of the key components that kept coming up as a similarity was context. You get personalized intention in a safe, trusted space. Like those two key components, no matter the version of care being offered, no matter the approach, be it structural, lomi, be it Traeger, be it lymphatic, be it whatever, Cuppen, Graston, whatever you want, each one of those present a overlap. And that overlap seems to be personalized attention in a safe space. And that's great for clinicians because what that does is it gives us the opportunity to have clinical outcome. It's horrible for research because it leads to an innumerable number of variables that mean we don't really know what's going on, which is tough when we're trying to come to mechanistic outcomes of manual therapy, how and why examples. Which actually gets me into one of the next things that I wanted to talk to you about, which was a little bit about the neurofascial approach. Because in some of the stuff that you have published and some of the poster presentations that you've done, I believe you presented at the 3rd and 4th Fascia Congress. And a lot of the stuff that you talk about, including in classes that I've attended of yours, have to do with the neurofascia connection and the matrix that makes up that communication behavior. What is it that brought you specifically to there as a potential route or as the focus that you wanted to put your attention onto?
Yeah, well, let me do a bridging maneuver from the research discussion we just had into that, which is, you ended with an observation that the multi-layered and multivariable nature of massage therapy is hard to study scientifically. And that's true, but the good news is it's not the only scientific field where that's the case, right? Psychology is a field where it's really hard to get translational therapeutic models that actually incorporate the biology as well as the therapeutic interaction, right? A psychologist might have a model of internal family systems, or might have a model of id, ego, superego, but they don't. Even a well-trained psychologist has the humility to say, my model does not equate with whatever changes in the regulation are happening in the insula or the limbic system or the cortex. They're just saying, this is my model, and within that, I will use my person to help this person, right? And that doesn't mean that it's not useful to learn the mechanism, but it informs a kind of a practitioner who's willing to hold lightly the models they have and say, there's a difference between the understanding I'm using to make decisions in the room and the claims I am making about the nature of the human organism and what's happening under my hands or in response to my words. So other scientific fields that besides psychology, another one would be ecology, right? A system where the outcomes, suppose you're trying to restore a watershed or a wildlife preserve, and you're trying to figure out what's broken, you're trying to figure out what would help, how to spend your limited resources. Well, you quickly come to realize that you can't predict the behavior of this system even a year down the line. The changes are emergent. And so whatever you do, you need to be willing to cycle your model of what's going on as you care for an ecosystem, right? So I was looking for...
So that cycling that you talk about, for me, it reminds me of a crisis of faith, and like I remember when I first started reading Paul Ingram's stuff, first thing I had was a crisis of faith in massage therapy. Have I been duping my clients for 15 years? And when I look at like the Better Clinician stuff with Ben Cormack and Adam Meakin, there's frequently a crisis of faith. And I think if you don't have a crisis of faith in any industry, doesn't matter what it is, but particularly in healthcare, then you won't really be able to move forward with your understanding of the human body and the human experience. I think we get stuck in this system where I have the answer, not I might have the answer. And there's such a significant difference in that single added word.
Well, like if you go back to the classic, like 1960, Thomas Kuhn's, Structure of Scientific Revolutions, you realize that crisis is a cyclical phase in any scientific endeavor. You've got periods, natural life cycles of a scientific paradigm where everybody kind of agrees on the basic causality at play. And then you have periods of crisis where people like cleave off and have their separate ideas of what nature might be doing. And sometimes that crisis persists over many generations, right? I mean, there have been people since 300 BC talking about a solar system with the sun at the center, starting with Aristarchus. And for centuries, every once in a while, someone would be like, hey, what if we were actually going around the sun? And every working astronomer with a paycheck would say, okay, whatever, but my model is what's actually working. And that's a model of everything goes around the earth and everything that does these little curlicue epicycles. And it took, over a millennium of careful refinement of measurement instruments until the instruments generated data that forced everyone into crisis, saying we can't explain what we're seeing based on our old understanding. And into that, over the course of a couple more centuries, we arrived at a different model of planetary motion. And so it may be that we are feeling something that is not going to resolve quickly.
So what you're saying is either be more patient or learn to be cryogenically frozen to awake in a millennia to finally feel somewhat satisfied, potentially.
Yeah. Or I think I take the kind of I think there is sometimes a paranoia that underpins some of these discussions of research, basis for our work, evidence basis, which is to say, like, some part of our ego is seeking solid ground or legitimacy or recognition from other
or community,
or community, and so we reflexively get tribal, or we imagine some future oasis of having arrived at the the true model. And, if you actually look at the history of any medical discipline, there are periods of convergence and periods of confusion. And we just have to play our part and try to do our best to look around at what is known now and bring that to bear in terms of helping people, which hopefully is what we ultimately care about.
So you segue perfectly into what I would have put towards the end of this conversation, but we'll bring it up now because it's an absolute perfect segue, which is divergent and converging ideas. And my last two podcasts, the one I did with ABK and Doug, were on defining massage therapy, which is one of the things that I want to talk to you about as well. And when we talk about converging and then diverging mentalities, defining massage/massage therapy will have a similar effect on both. It will converge, it'll bring some communities together, but by its very nature of definition, we will also diverge some of that community. Some people will get pushed to the outside of what that definition means. Whether they agree with it or not is, kind of inconsequential at that point. So you're familiar with the paper. You and I have already spoken about that. My listeners will already be familiar with it because we went over it in detail with ABK. This conversation is less about the paper and more just, as a practitioner who's been in the industry 18 years, who, let's be honest, is on the younger end, similar to myself, of being in the industry. Most massage therapists who have I'm glad that well, most therapists who have been in the industry 18 to 20 years, this is not our first career. This is our second or third career. And, I know that this was the first thing I ever went into, and we're a similar age. And so I'm assuming it's very similar for you. And so your bread and butter has been massage therapy. It's kind of your life's work. You teach very, what I would consider quite revolutionary material, though the approach that you have, though it is founded in very good literature and founded in good research, the way it's presented is really this embodied experience, which, massage therapists will be familiar with that term, but when they take the class, they start seeing that it's not quite what they would have originally associated with embodied experience. And so with all this in mind, having been a student running a clinic, still correct?
In the most emeritus way. Yes.
Okay. Having your own practice and then teaching quite a bit online, at least, and then somewhat in person. If I were to ask you, do you think defining massage therapy is something that you could possibly do? And is it something that we as a profession can come to grips with?
You're asking me if I could possibly do it, or if one could possibly do it?
Both. I like personal opinions. I mean, it's not like you're going to be right, and it's not like you're going to be wrong, right? That's what opinion is. Everybody has one.
Well, I think I had a chance to listen to some of Anne Blair Kennedy's conversation with you, which I was gratified to hear, and just joyful to hear her voice speak about these times that I was present with as well. And she said something about that clarifying definitions paper, which I, among the many useful things, which was that context is everything, both for how you understand what happens in the treatment room, but also context is everything for how and why you would seek to define massage therapy. So to me, the difficulty of defining massage and massage therapy, and the reasons why you might want to do it, it really helps to be clear as to what in that definition you are seeking to accomplish. Are you trying to get at least a subset of massage therapists better pay, for example? And what are the available income mechanisms there? Because perhaps if you defined it better, then you could value the care better in some systematic way, and then people could get paid better. Are you trying to improve the work of healthcare teams so that if a referring clinician knew more about what transpired in the treatment room, they could make better decisions about when and how much to recommend massage therapy? I frequently get referrals from surgeons, or rather, rarely does the surgeon refer to me, but the surgeon clears a person for massage and manual therapy after a certain interval of time. This is a decision a surgeon makes with very little understanding of the choice points in my work, right? How much, hopefully, how much intentionality I can bring to a session, where I feel in many cases I can work safely, just a couple of weeks after surgery, as long as I'm not, stressing the tissues that were altered. And so a better definition might improve the work of the healthcare team. Are we in a definition trying to just improve the inner workings of our profession? I think those are all like legitimate reasons to try to work toward a definition, but I might seek a different definition depending on the context, if that makes sense.
That definitely makes sense. And it brings up a unique, the last example you used of, a surgeon clearing a patient for some version of massage therapy and then not necessarily understanding what type of massage they're going to go get. The defining of massage therapy does it give us the opportunity to then say this percentage of the population who provides massage therapy falls under the definition, let's say medical, and therefore you are cleared for medical massage as opposed to relaxation. And in theory, it means different versions of education, right? If you're going to have tiered systems of types of therapy. And I know a lot of people think tiered is definitely level to level, but let's say next to each other, because it's not that one would be better than the other. But so with those definitions, you showed off 3 positive examples where we're talking about, okay, better pay, better integration into healthcare systems, better, understanding of it within the industry. But just to play devil's advocate, even though I personally am a big fan of the idea of defining massage therapy, and I actually think our hand is going to be forced. If we look at some of the research coming out of the NHI, we look at some of the stuff coming out with veterans associations, our hand will be forced by systems that are in place that are much more powerful than the massage therapy profession. The VA being the largest one, the DoD, they have clout, they have influence, and they have finance. All 3 of which have promoted massage therapy greatly in the past 10 years. They've done incredible research that's really said massage therapy is a good alternative to opioids. It's good for pain in general. It's good for mindfulness. Like there's a lot of pros that they've done. But if they keep pushing money towards this, in theory, the next evolutionary step of that would be, well, then we're going to recommend massage therapy. But if we are going to recommend massage therapy, we have to recommend it within, as you said, context. And these humans contextually fit what we're looking for. And these other humans do not fit what we're looking for, though they hold the same title. So for me, I think the industry in the next 15 years or so is going to be forced into either being on the receiving end of a definition that an outside association gives us, or one that we have a hand in trying to promote and say. And so one of the cons in the definition, however, though, is all those people who are stuck on the outside of the definition, who have been self-employed for 30 years, who have a thriving practice in a small town, who don't necessarily want to go out and do other versions of higher education because they're either near retirement or whatever it is. And for them, they might get stuck outside of this definition of what massage therapy is, even though contextually they've been offering positive care for very many years. So the definition, even though I am a fan of it, comes with some pretty big consequences on both sides. And it's just one of those things where it leads us to wonder at the benefit of it. And then if there is a benefit, the actual definition, which is something very hard to do, obviously.
Yeah. I think you are asking a good question. I think you're making a good prediction that it's going to be tricky, and I tend to agree with you that some kind of specification of medical massage is helpful. And I don't mean medical massage is different than another form of massage therapy if you took a 5-minute video of the hands doing the work. I mean medical massage as a practitioner who has equipped themselves with the ability to interface with the medical
It means
system.
more knowledge. higher education at that point.
And a different, it means a very specific intent to work in a certain kind of way that interfaces you with other teams. And there are, in other healthcare professions, for example, let me use psychology again. There are counselors, psychotherapists that have a very, very wide orbit from any kind of healthcare team. It's like, welcome to my world. I do what I do. I'm going to do it to the best of my ability, but I'm not really going to like exchange information with any of the other practitioners, and I'm not going to, try to update my scientific understanding of what's going on. I've got my thing, and I think that by whatever mechanism, the healthcare system, the best kind of healthcare system, needs a way of finding the folks within every profession who are equipped to work in teams, to take into account, clinical findings, take into account recommendations from allied practitioners, and communicate back. And that to me is, it's not that we will arrive at a definition. It's almost like this is a rabbinical devotional practice where we have to keep finding a definition as part of our faith in what we do.
Absolutely. It's interesting because when I was in Phoenix 2 weeks ago at MT National, the closing the discussion was a panel of 4 presenters, one from the VA who was an acupuncturist, one from the School of Medicine in Phoenix, one from the Mayo Clinic, and another one from NIH. And I can't remember their names because if I didn't read it in a research paper, I don't remember it. But they were presenting essentially a unified front. Not a single one of them was a massage therapist. 3 of them were doctors. All of them were researchers. And they were presenting a unified front of massage therapy needs to be integrated into healthcare teams. It was a unified front, and they had all this research that was, very, very feel-goody for massage therapists. After 2 hours of listening to them, it's not like we wouldn't think we'd save the world, but it was from the outside saying, yes, this has to happen, this has to happen, this has to happen. So I would agree that, massage is one of those things where if you're going to be involved with a client in a therapeutic medical environment, then having the ability to work with a team, communicate with a team, becomes integral. But with that also comes the idea that when not to do something. And for me, that I think is one of the largest differences between what I would say, similar to that clarifying definitions paper, massage versus massage therapy. ABK talks in the paper, one of the sentences that one of the subjects said was, massage is easy to describe and hard to define. All right. And a very accurate sentence there. But one of the things that I think would help separate those a little bit is, what is the difference between massage, which is something that maybe a mother is doing to a child at home, or a father is doing to their daughter at home, versus massage therapy,
or a heart surgeon is doing to a heart.
Exactly. Versus massage therapy. And before we can define massage therapy, I think the beginning has to be defining the difference between the two, because one is considered a common term that the general population, everybody and their uncle can do. And one is something that in theory only trained professionals are supposed to do. And I say supposed to because I'm in a non-regulated province where anybody can do massage therapy. So it doesn't really matter. But there's pros and cons. But it's one of those things where the definition between massage and massage therapy becomes almost essential to begin looking at the definition of massage therapy itself, because until we know what we're not, we won't know what we are. And it's almost an asinine way to look at it. Like, why not just define what you are, and then what you're not will naturally occur? But I don't think that's happened. You look at 85 years ago, physical therapists were a association and they were unregulated. Now they're DHPT, now they've moved far in the opposite direction. There's no reason massage therapists can't follow a similar pathway. We might be, doing it on a different trend or a different timeline, but their definition didn't exist in the 40s. It only came out in the 60s. And so if that's the case, why could we not do something similar, kind of thing?
Yeah. Boy, there's a lot of legs to that stool if it gets built. There's something that I value in the massage therapy profession, which has to do with the sort of experimentalist, entrepreneurial, hard to herd cats kind of, a lot of curious minds who like to lead with their intuition sometimes, and perhaps find it beside the point at times to engage in a lot of discourse. And so every discussion I enter into about massage therapy research or massage therapy definitions is really an internecine debate with the tiny subset of massage therapists who have
the majority of massage therapists just don't care.
And let's give them their fair due.
Oh yeah, there's nothing wrong with that. Nothing wrong with that.
What they care about is showing up in a room, having people visit them, and having those people walk out grateful and feeling better. And like that's and it doesn't align with their life goals to service some deeper understanding of what all of us do. They just want to, here's what I do in my experience, and that's enough.
And so you get sorry, you get to you get to a really interesting part of what massage therapy is, because that innate aspect that tends to come from within people within this profession, which doesn't seem to exist in all professions, that curiosity and that I'll use the word you used, intuition, which if you listen to some of my other podcasts, you'll see I'm not a big fan of that word for a multitude of reasons, but for whatever reasons. But whatever it is that makes massage therapists, which there is something different. You go to I've been to many conventions of different industries and professions, and massage therapy, you go and it's a touch on the arm. It's the community, the sense of belonging is so different. And I think that comes naturally to those individuals because that's what we do every day to people who come into our offices. And the ability to have a positive outcome on our clients, I think, is founded in that sensation and in that experience. And so without that, defining massage therapy becomes moot. Like that almost ineffable concept has to be part of the definition. But it just leads to one more problem, which is still how do you put something ineffable into a definition that's already complicated to make?
It's tricky. I think that some definitions succeed in creating a dance floor as opposed to being the whole dance, if that, so they allow for emergent uses of that definition in very, very different contexts. That is one quality of a good definition to me, is one that is specific enough and also
gray enough,
gives enough space to the specification of however you're using it. So having given fair due to the sort of culture in our profession of individualist thinking and let's say not intuitive, but of implicit reasoning, and I want to take the other side now and say a lot of our work, the structure of our profession as it has happened to exist in our lifetime, it generates a lot of egocentrism, I think, in how we work. Most of my job is in a room by myself, very little interface with my colleagues. And honestly, my massage work is almost always rewarding, almost always easy. If I have to go and talk to other massage therapists in the classroom or in a research conference, that's it's fun, but it's also hard work, and yes. So there are many days where I'm just let me just help people feel better. And you know what? The people that don't feel better, they won't even come back. So only the people that like what I do come back, and it just generates this beautiful.
But isn't that such a potentially self-destructive bias? Only the people who like what I do will come back. I mean, there's great value in that. You'll be able to pay your mortgage and provide for your family, and those are all very valuable things. But at the same time, are we helping the potential humans? Are we helping the majority of the potential people we could be helping by only
Not if,
having?
yeah, not if you truly care about that, about helping others to the best of your abilities. And that's where the egocentrism needs to kind of go away. The reason for me to do the hard work of testing your ideas against other people's ideas, do the hard work of trying to come up with ecological models of nerves or whatever you're working with, that like keep turning the soil of your work, is because not doing so is boring, and it leads to it leads to a kind of a slow death professionally, where you just carve yourself an ever more sterile,
restricting environment.
And so, but I put it in ego terms because there's a fragility that I feel sometimes, and that I have seen in others of my profession when it comes to being challenged. And it's also a fragility that actually lives inside some of the more skeptic evidence-based set. And that goes something like this. We need to gather up this arsenal of confirmatory research, or we need to gather up this arsenal of stuff that feels legitimate to other professions, so they will finally respect us. And having worked in medical offices since the age of 15, growing up with a physician for a mom, I can tell you there is no specialty in medicine that feels adequately respected.
It's funny. I talk about this quite frequently, and when I teach, and even when I ran education in Colorado, is this idea that, the inferiority complex. Massage therapists are like, we're just rife with it. This sense that no matter how positive the outcomes in the room with our clients, the moment we have to present our findings, either the vernacular is not there, the confidence isn't there, the language isn't there for us to feel justified in saying this is the right course of action. Even though clinically, if we look at the statistics, clinically, massage is an incredibly beneficial thing to be offering the population, especially a population in pain, but even just a population in stress. And yet when it comes to the why of it, there's just this sense of inferiority within the industry. And I don't know if it's because of the environments in which massage therapists traditionally get hired, where they're, Benny Vaughn started a clinic in Texas where it's a massage clinic that hires PTs and hires chiros and hires ATs and hires other professions to work under the massage therapy umbrella. And it's probably the only place I've ever heard of in my life that does that, because the majority of the times it's the massage therapist working for the other individuals in their clinics. And usually those other professions are much more educated. Their schooling is longer. They have to do research. They have initials behind their name that are much longer and, stand for more, and et cetera, et cetera, et cetera. And so it's just that everlasting inferiority complex that makes us go, if I have to defend what I'm doing, I don't know if I can defend it, or if I feel confident enough to defend it. And like it needs a defense.
Yeah.
Bizarrely.
I mean, the sense of inferiority, or the sense of not being enough recognized or misunderstood, it's like kind of get in line. This is what it means to be in a specialized field. Ophthalmologists and ultrasonographers and
psychologists.
From the beginnings of their training onward, they get a message from their instructors, which is very ego confirming, saying, no one really gets us, but we do something special. And if only people knew more about what we do, then we could help more people, etc. That's universal. But guess what? Ophthalmologists, I think, get paid more than massage therapists.
Exactly right.
Ophthalmologists get a referral stream from other practitioners who know what they do, enough at least to send appropriate patients to them. Ultrasonographers have evidence-based training where they can tell that they know whether they have very clinic specific guidelines about how much pressure to use, what aspect to point their probe, what it means to properly visualize an ovary. that's an art form that has a lot of feedback from scientific evidence.
But
So
you
keep in
come back
mind,
to this, you come back to the key component. They have those things because they have a defined profession.
yeah.
They have their guidelines, and those guidelines are based off a clear stasis of this is what I do.
But is that defined profession a set of words on a page? Or is the definition they have built into the structure of their education? And
I've never looked at like ophthalmology and things like that, but I know there are some industries or some professions, I should say, that definitely have definitions. MDs have definitions, chiros have definitions, PTs have definitions. I would be surprised if the majority didn't have some version of a definition that is universally accepted. Whereas in massage therapy, in the class that in my sensory class, I have a page, and on that page I have 16 different definitions: Mayo Clinic, Cleveland Clinic, National Cancer Institute, the College of Massage Therapists in Ontario, British Columbia. Like there's just this multitude of different institutions and associations that have definitions that have somewhat similarities, but some are very variant. And it's just interesting because I would have to look into it, and I probably will, but I wonder at the other professions if their definitions are as variant. But if you look at massage, we have over 300 different modalities in massage therapy. Other industries do not have 300 different modalities. Like they have a scope of practice that is probably not 300 lists long. If you're a GP, as soon as you move away from general, you get into specific and you're referred out. It's your definition is now different.
I would say, I mean, it really depends on the profession, the healthcare profession, whether or not you even think in terms of a suite of modalities or not. Um, a primary care physician has a modality called injection therapies.
Mm-hmm.
They have a modality called stethoscope screening, but really they just they have skills that are in their scope, and they bring them to bear, procedures and assessments, etc. I don't doubt there are definitions that have been written down for other professions. I'm curious, and I know that you are seeking to lead discussions on this. I'm curious if the definition that gets written down is the starting point for some professionalization, or if it is a byproduct of the discussions that and the culture that needs to happen.
At the last education event I did in Colorado, it was the last one I was doing on the Saturday morning. I broke all the attendees up into small groups of 7 people, and they had 30 minutes as a group of 7 to come up with a definition of massage therapy. And when we were done 30 minutes, somebody from each group had to present it to the large group and saying, this is what massage therapy is. And it was funny because when the 30 minutes was up, which is not a lot of time, especially for 7 voices, but when the 30 minutes was up, not a single group had a definition of what massage therapy was, but every single group had a definition of what it wasn't. Uh-huh. Every single group had an opinion about what massage therapy wasn't. No group had an opinion about what massage therapy was. And to me, that was a very interesting way of looking at it, because it's almost like, well, maybe we'll come to that definition through the process of elimination. If we ask enough massage therapists what massage therapy isn't, we'll eventually get to what it is with the leftover behavior.
Yeah.
Hey, our time is almost up, but before it is, I wanted to ask you about one more thing that is not related to the definition, but it was something that you did. I think it was in 2016. I can't remember the exact date, but it was really interesting to me, and I haven't been able to see if it went anywhere. And it's the open source tool that you were going to use for the integration, the interface between the nerve and the fascia. And in it, your guys' recommendation was that something has to be going towards that. Did that ever go anywhere else?
The short answer is no. But where it is an object still of great interest to me. To tie it back to our research capacity discussion, if I were working in a university group or something like that, I think I would gladly have grad students or colleagues, or it would be my paid job to
research that.
to work in Google Docs, and that publication came at a time when I was still very interested in sort of articulating the ecology of the nervous system, especially the peripheral nerves as they relate to their container, which is what we were doing. We were generating sort of a list, which I'm happy to share with you, of all of the instances in evidence where a peripheral nerve is crossing through or relating to a dense connective tissue, insofar as trying to define not just the main bony foramina through which nerves travel, but all of the mechanical predicaments, all of the potential challenges for the peripheral health of nerves, as a tool that then, not just as a spreadsheet, but as a navigable kind of subway map, shall we say, of the human neurofascia. And at the same time, I was ramping up efforts to record an album, because I'm also a musician, and so the focus of my life turned strongly toward music for a few years there. So there it lies, one of the many unturned, unwatered seeds of Mike's life.
Well, and research in general, right? Like how many research papers end in recommendation and just end in a recommendation and then never see the light of day after that.
I have a patient right now who is a researcher into bone tissue, and he's very clearly a basic researcher, and he's like very respected in his field. He's not trying to be translational. He's just trying to understand how bone works physiologically, and it's just fascinating stuff. But he said, there are some people who really prize, staying with one research direction for however long it takes, 20 years. And if people have the patience for that, great. I need to start with where I'm interested in and what I feel compelled to produce. If I don't catch that wave, I don't do anything interesting. I'm just chasing tenure, and so I'm always looking in my life to carve out time for research and publication, because I think it's a big service to the profession. And so we'll see where that map of the neurofascia goes.
Is that what brought you to the neurofascia approach? Is that like one of the founding blocks that kind of progressed you forward to that thought process?
I think one thing was just spending a long time in cadaver study, where I was really struck by the juxtaposition of these nerves with their local environment in a way that was oftentimes hard to gather from anatomical textbooks. It was very clear to me that one needed not just an idea of lumbar foramina, but also an idea of the structure of the thoracolumbar fascia to understand what's happening with a radiculopathy or neuralgia paresthetica or some irritation that seems neurogenic. So that was one piece of it. The other piece of it for me was a consistent emerging theme in the fascia congresses that I think is worth taking into consideration, no matter your level of skepticism about the ability of fascia to change its length within a layer, et cetera, is that fascia is innervated, and that innervation can be very sensitized in some physiologic circumstances. And so the body's denser connective tissues as a sensory organ fascinates me. And especially because I'm interested as a clinician in talking to the nervous system via its force carrying tissues, right? And so
it's one of the reasons,
and the nervous system as a mechanical moving thing is what caused me to kind of seek the relationship between those two, both in my work and in research.
It's always one of the reasons why I've enjoyed your classes and your online material, especially the Facebook Lives that you were doing. Because for me, I like to go one step removed from that, which is I'm going to talk to the nervous system through the sensory system, because that's all I have is my hand and their skin. And this skin is the dominant sensory organ in the body. And so whatever effect I have, intentional or unintentional, on the muscle system, on the mechanical system, and even on the neurological system, are all subservient to the input that the sensory system perceives. Threat, no threat, vigilance, no vigilance, feel good response, anxiety response. And the sensory system gets to, the speed with which we approach the human on the table with our hand. Their eyes, their sensory system picks all that up and says, threat, no threat, let alone the touch itself. And for me, that's always been the one step beyond it. But it's like the next conversation is, okay, well, now that I do have the sensory system engaged, what am I trying to communicate with a nerve? What is the communication that I'm trying to create with intent? And it's one of the reasons why I've always find your material really buddy with a lot of stuff that I think about. So I've really enjoyed it all.
I love, I'm always thinking, just because I have this interest in peripheral nerves, I think the truest thing I can say is I'm always interested in the local tissue that is sort of having a certain physiologic state. It could be a normative state or an inflamed state or a physically damaged state, but there's a population of receptors there that it has a certain baseline. And then there is the sort of conveying fibers of the nervous system, and there's all kinds of events that can happen along the path of nerves that I'm interested in, which would modulate the incoming flow of sense data. And there is, of course, the various representations of this body tissue in the central nervous system. And the higher up you go, the more you build context for that sensory information, and you apply prior models to what's going on until finally reaches your conscious experience. And so, I would say if you took a video of my work now versus 10 years ago, I think the moves would look very similar, but I tend to enroll my patient in a lot more sensory contemplation, sensory orientation to what I'm doing. Because, as you say, that kind of, it's I'm a big fan of ABK's statement that I think the use of words, the communicative piece of the relationship, I think, in my opinion, should be integral to massage therapy. And it doesn't mean that I have to be psychotherapeutic in my use of words. It means I'm using my words to orient a person safely to their sensorium. And
isn't it called kinesthetic awareness? We bring them into their kinesthetic awareness
and their interoceptive awareness, right?
Yeah.
And the organic homeostatic state of their organism. And so whether it's the spatial awareness of their body or the affective autonomic awareness of their body, the visceral awareness of their body, that it could be as simple as how's the pressure, or it could be as complex as I want you to breathe into the back of your heart and imagine it blooming like a flower. And as we do that, I'm just going to follow your breath with my hands, right? That's not a thing that a psychotherapist would say, or maybe.
It's also not something that you could actually ask someone to do, and yet it instantly makes somebody want to attempt it. Like your heart doesn't open like a flower, right?
Well,
but at the same time,
of your heart opens like a flower.
Exactly, and that's where it is. It's when we take that wording. So, like one of the parts in the sensory class I teach, we talk about auditory. So we talk about what do they hear. So first of all, are they unconscious or are they conscious? If they're going to hear something. Secondly, what do you say? Your tone of voice, the speed of your voice, the pattern of your voice, the cadence. Do you have a rhythm to it? Is it slow? Is it confident? Do you use descriptive text or exact text? And it should change from client to client and session to session. But it's just one of those things that, it's why I've always liked a lot of your material. So thanks. And this is the opportunity for you to plug some of your material. If you want to, feel free. I'm a fan of promoting other people's practices.
Well, I teach continuing education for body workers as well as a larger audience, classes I call embodied anatomy. So if you're interested in that, you can go to integrativebodyworkeducation.com. And all I can promise is it's always different every year. with every iteration of class, because I'm doing my best to teach with an awareness of what the science says, as well as with the best possible representation of how to help people.
Are you still doing your Thursday night lives?
I'm still on some interval doing free live streams, which I invite you to join either on YouTube or Facebook. Sometimes I call it Embodied Happy Hour. And in the midst of the psychedelic experience that is early parenthood, I still haven't found a consistent rhythm. But
it doesn't get any easier, man. It doesn't get any easier.
I know.
But we're our most creative when we're exhausted, right? Your brain has no filter, so you think of the best things.
It doesn't get any easier. I'm just trying to milk the excuse as long as I can.
Awesome. Well, thanks so much, Michael, for joining us today. I really appreciated it. I'll send you the audio of this as well for you. And I'm really grateful that we had this opportunity. I'll stay in touch over Messenger. I definitely will want a list of those interaction sites between the nerves and the fascia. I love that stuff. And because I'll be in California on November 18th and 19th in Emeryville, outside of San Francisco, it's the closest I'll be to you. But if ever you want, I'll be down there. Feel free to come down and take my class. I would love to have you there. It's a fun moment, and it's always enjoyable to have you around.
Troy, you're a gift. I hope this podcast blooms like a flower in the back of your heart. And I look forward to being in your classroom sometime.
Have a great day, Michael. Thanks.
Bye-bye.
There's a time when the operation of the machine becomes so odious, makes you so sick at heart that you can't take part. You can't even passively take part. And you've got to put your bodies upon the gears and upon the wheels, upon the levers, upon all the apparatus, and you've got to make it stop. And you've got to indicate to the people who run it, to the people who own it, that unless you're free, the machine will be prevented from working at all.